I am about to reveal something that might shock you. It might be in your bathroom cabinet right now, silently sabotaging the most crucial function of your body overnight. I am Dr. Evelyn Ross. After 2 decades dedicated to urology and men's health, I have observed perfectly active people walking into my office with irritated bladders and prostates. This wasn't due to serious disease, but to habits and substances they blindly trusted. I am not talking about exotic drinks or experimental treatments. I am referring to the juice you drank at lunch, the snack you consumed before bed, or even that muscle relaxer you took last week without a second thought. What I am about to share goes against everything you have been told about managing nighttime urination or nocturia. Food and supplement companies do not want you to know this. Most doctors will not tell you because they simply do not realize the devastating connection between small dietary details and prostate hyperactivity. But I have seen it with my own eyes, patient after patient, nocturia after nocturia. I refuse to stay silent any longer. By the end of this video, you will understand exactly which 5 triggers are secretly infuriating your prostate and bladder. You will learn why they are so dangerous after age 50, and most importantly, what you can do starting today to protect your sleep. This is not alarmism. This is the truth that saves nights. Stick with me, because what you are about to learn could literally add years of uninterrupted sleep to your life. Let's start with the culprits present in virtually every routine here in Brazil. Caffeine-associated bladder aggressors. You know them by names like espresso, energy drinks, and certain black teas. They are your solution for morning fatigue, the mid-afternoon energy slump, and often a crutch for improving focus. They work brilliantly. There is no denying that. But here is what no one tells you. Consuming these drinks regularly after age 50, especially if you already have an enlarged prostate, is like playing Russian roulette with your urinary system. The urological community has known this dark secret for decades. In published studies, caffeine has been identified as both a diuretic and a direct stimulant of the bladder muscle. Yet millions of people still ingest them daily as if they were harmless, completely unaware of the threat hidden in every sip. Let me tell you about João, a 72-year-old patient who loved meeting friends in the late afternoon for coffee. He suffered from benign prostatic hyperplasia and woke up 3 or 4 times almost every night to urinate. One afternoon, while playing cards with his friends, he felt a sudden, intense urgency. He barely made it to the bathroom, and even then he felt like he did not empty completely. When he arrived at the emergency room, we discovered he was retaining large volumes of urine. His bladder, already working overtime due to the congested prostate, simply could no longer relax and fill appropriately. The trigger was not a new prostate condition. It was the continuous use of that innocent coffee cup hours before going to bed. How can something so common be so problematic? The mechanism is insidious. Caffeine not only increases urine production in the kidneys, acting as a diuretic, but it also acts directly as an irritant. The bladder, like a muscular balloon, has sensors that fire when they detect certain substances or distinction. Irritating caffeine causes the bladder muscle to start contracting prematurely, even when the volume of urine is small. This creates 2 catastrophic effects. First, the urge to urinate becomes urgent and frequent. Imagine your bladder as a reservoir. If the full sensor suddenly triggers much earlier, the reservoir needs to be emptied much more often, including at night. A young bladder can handle this stress. However, a bladder already dealing with age-related obstruction or struggling against a tense prostate muscle can fail completely, exactly like what happened to João. Second, caffeine can slightly dehydrate you during the day. Ironic, isn't it? Over the course of the day, this leads to more concentrated urine at night. Concentrated urine is much more acidic and irritating to the bladder lining, leading to a vicious cycle of more bathroom trips. It is crucial to understand that the risk depends on the dose and the timing. Strong coffees and energy drinks consumed in the late afternoon or evening are most strongly associated with nocturia problems. Low caffeine herbal teas appear safer, but the risk is never zero. And here is another shock. If you try to drink a lot of water throughout the evening to dilute the urine, morning caffeine consumption can nullify the effect by destabilizing the overall water balance. So what should you actually do? The solution is not to suffer from lack of energy. It is to have a frank conversation with yourself and your doctor. Ask directly, "Doctor, given my nocturia, what are the cutoff times for caffeine consumption?" Alternatives exist. Sometimes reducing consumption to one morning coffee and switching to decaf or fruit teas in the afternoon is enough. Other times, using electrolyte-rich drinks during the day to maintain hydration is an excellent choice. And if a stimulant is absolutely necessary, the golden rule is lower dose and never after 2 p.m. Now we come to number 4. This one will absolutely surprise you because it is often marketed as a digestive soother. Processed and acidic foods. I am talking about canned tomato sauces, wine vinegars, and certain types of citrus fruits consumed in isolation. These are among the most common items consumed in the home. Millions of people eat them every night, almost as a ritualistic accompaniment to dinner or to prevent acidity from other foods. And here is the bitter irony. The food you consume to protect your stomach or satisfy your palate may be creating another danger through the back door. Let me share the story of Helena, 68, who loved preparing homemade tomato sauces full of spices and balsamic vinegar. She was advised to reduce her salt and focused only on that. Her digestion worked well, and she never questioned her eating habits. Years later, during a Nocturia evaluation, her voiding diary showed something unusual. The peak of nighttime irritation correlated not with the amount of water she drank, but with the residual acidity of her last meal. The culprit was the chronic and excessive use of these acidic ingredients. These foods, especially when seasoned with chili or curry, release metabolites that directly attack the bladder wall. The bladder is lined with a protective layer, glycosaminoglycans, but high acidity can erode it or make it hypersensitive. When this protection is compromised, the bladder becomes electrically unstable, like a brick wall without mortar, and dangerous, unnecessary contractions can arise. The cause of Helena's irritation was the chronic use of strongly acidic and spiced sauces. They reduce the need to drink water during the day, but that acidity is absolutely crucial to maintain bladder equilibrium. When the bladder is under prolonged chemical attack, sensitivity collapses, but it does not stop there. There is something that concerns us even more. Multiple observational studies have found an association between an irritant-laden diet and overactive bladder syndrome. One theory suggests that these acids might exacerbate low-grade inflammation in the prostate. This inflammation saps a molecule that keeps prostate tissue deflated. When it is depleted, the prostate swells and hardens, setting the stage for greater obstruction. The causal relationship is still debated, but the association is deeply worrying. Furthermore, acidic foods can interfere with vital vitamins, such as vitamin C, which is important for the bladder lining, making this protective tissue less effective and leaving the patient vulnerable. The problem is that these foods have become commonplace. They were created as accompaniments but have become a permanent solution for flavor that could often be achieved with changes in preparation. If you have been consuming strongly acidic or spiced sauces for months or years, do not stop them suddenly, but start reducing them. Talk to your doctor. Ask, Do I really need these ingredients at night? Can we reduce the acidity? Are there alternative seasonings? And if you must consume them chronically, it is essential that your doctor monitors your urinary condition periodically. Before we continue with the next factors, which include some related to simple sleep, I want to make a quick request. If what you have heard so far feels valuable, I ask two simple things. First, subscribe to this channel. My mission is to provide clear, direct health information so you can make the best decisions. Second, and perhaps more important, share this video. Think of your parents, your grandparents, your friends. A simple click can start a conversation that could genuinely save a night's sleep. Thank you for your support. Let's continue with number 3, one that almost everyone has at home or consumes embedded in food. We have arrived at number 3, sweeteners and refined sugars. Used to add flavor and pleasure to foods and drinks. They are the magical solution for that sweet craving that won't leave you alone. But this magic solution can cost your bladder dearly, especially if you already have prediabetes or any metabolic disease. Margarita, a 75-year-old retired teacher, had the habit of drinking a diet soda after dinner, thinking she was avoiding sugar consumption. To avoid sugar, she bought a well-known soda with aspartame at the grocery store. On the second day, she felt her bladder was constantly full, along with a dreadful urgency and discomfort at the end of urination. Her son took her to the hospital. Her urinary frequency was extremely high, and she had developed apparent inflammation, chemical cystitis. That artificial sweetener had pushed her to the limit. Why does this happen? Artificial sweeteners and highly concentrated sugars are irritants to the mucous membrane. Their job is to trigger taste receptors. In your mouth, that is great because it reduces the need for sugar. But the substance does not just act in your mouth. It travels throughout your body, being filtered by the kidneys and coming into intimate contact with the bladder. This has two consequences. First, by irritating the bladder, its muscle must contract against much greater resistance or simply become irritated. It is like trying to push water through a squeezed hose. The discomfort increases. This can trigger dangerously high spikes of urinary urgency. Second, they are potentially hormonal disruptors. They make your bladder respond faster and more irregularly. If you already have a sensitive bladder, this extra stimulation can completely destabilize it. Recently, European and American agencies have redirected attention to aspartame and other sweeteners due to their link to rare but serious syndromes involving altered renal and nervous function. This only demonstrates how powerful their effect is on the entire organism. The greatest danger of these foods is that they are available everywhere. People consume them without reading the fine print and without thinking about the risks. If you are over 60, and especially if you suffer from nocturia or any urinary condition, avoid them completely near night. Much safer alternatives exist. Use small amounts of honey, natural fruits, or gradually adopt a less sweet palate. Do not let the pleasure of your palate become an emergency for your sleep. We arrive at number 2, a delicate yet vital topic, joint health and sleep. I am talking about an older class of muscle relaxants or certain sleep aids that are still sometimes used for chronic pain or insomnia. Medications like cyclobenzaprine or certain old antihistamines with a sedative effect. Chronic pain itself is a risk factor for nocturia because it interrupts sleep. That is why treating it is crucial. But how we treat it matters immensely, and these medications can be dangerous for an aging bladder. Francisco, 78, suffered from terrible back pain due to osteoarthritis. His doctor prescribed a low dose of a muscle relaxant to help him sleep. This helped with the pain, but he started feeling great difficulty initiating urination and felt the stream was very weak. One day, he had difficulty emptying his bladder. The cause was the muscle relaxant. It suppressed the normal contractile capacity of the bladder muscle, causing what we call vesical hypocontractility. But that is not the only risk. These medications can also have anticholinergic effects. This means they affect the nerve messages between the brain, bladder, and prostate. They excessively relax the detrusor muscle of the bladder, but can also make it difficult to open the prostatic sphincter. This manifests as urinary retention and increases the risk of urinary tract infections. For all these reasons, these relaxants or sedatives are no longer the first choice for treating pain or insomnia in older adults with prostate issues. Today, we prefer safer approaches for the bladder, although they are still prescribed for neuropathic pain. If you or a loved one takes one of these medications, it is essential to talk to your doctor. Have safer alternatives been tried? Is urination being monitored? Mental and physical health go hand in hand with urinary health. You need to ensure that the treatment for one thing is not threatening the other. And we arrive at number 1. This is perhaps the most controversial and debated point, but it is my duty to share the worry that exists in the scientific and urological community. I am talking about vitamin supplements and natural diuretics. Yes, you heard correctly, those pills that millions of people take every day to balance minerals or to cleanse the body. For decades, the message was crystal clear: take vitamins for overall health. But in recent years, more and more studies are questioning the safety of self-medication and the use of high concentrates for Nocturia control. Let me tell you about Laura, 70, worried about fluid retention, which she self-diagnosed. She started taking a high-dose green tea supplement, which is a diuretic, on her own, and without investigating the cause of the swelling. Years later, she complained of extreme nocturia. She did not have the classic risk factors for advanced hyperplasia. Her lifestyle and weight were good. Investigating possible causes, her medical team focused on that daily supplement. The controversy is real, and the evidence is not definitive, but the hypothesis worries us deeply. Hydration from food or slow water intake does not seem to be a problem. It is absorbed slowly, and the body uses it efficiently. The problem seems to arise with highly concentrated doses of diuretic supplements or fat-soluble vitamins that require a lot of water to be processed. When you take a concentrated pill or extract, it creates an artificial peak of urine production in your kidneys. Your body cannot use all that water for cell hydration, and the excess has to go somewhere. Worse, it forces the kidneys to work unnaturally. The main concern is that this deregulates the antidiuretic hormone, ADH, which is fundamental for concentrating urine at night. This process of diuretic overload modifies renal chemistry and can contribute to the production of large volumes of urine at night, nocturnal polyuria. Some large studies suggest that the self-medication of natural diuretics modestly increases the risk of electrolyte disturbances. Other studies have not found this connection. The evidence is complex, and for people with diagnosed deficiencies, the benefits may outweigh the risks, but the lesson is clear. More is not better. The safest strategy is to get vitamins and minerals from your diet. If your doctor believes you need a supplement, never start taking it on your own. It is a medical decision that must weigh your overall health and, very importantly, your risk of nocturia. Today, we have uncovered the hidden side of 5 very common types of food triggers and substances that affect your bladder. Late consumption of caffeine, acidic and spiced foods, sweeteners and refined sugars, certain muscle relaxants or sedatives, and hyperconcentrated or diuretic supplements. My core message is not panic. It is not stop taking your supplements or stop eating. Doing so on your own would be extremely dangerous. My message is empowerment. You now have valuable information that most people ignore. You know that the drink meant to energize you can overload your bladder. You know that your favorite tomato sauce might be affecting your voiding pattern. You know that a simple sweetener can be a risk at night. Use this knowledge to become an active partner in your own health. The next time you visit your doctor or nutritionist, go prepared. Bring a list of everything you are consuming, including supplements and teas, and ask clear questions. Doctor, I read that this substance can pose risks to my bladder. Is it still the best option for me? Are there safer alternatives? Should we monitor something like urine chemistry or perform specific tests? Every treatment and every habit is a balance between benefits and risks. That balance changes with age. Your bladder has been working hard for decades. It deserves exquisite care. Protecting it is the best investment you can make in your future. Do not take any food or supplement for granted, no matter how common it seems. And now I ask one last thing of you. Share your experience in the comments. Did something here surprise you? Your stories can help others. And remember, always talk to your doctor. That conversation is the most important step you can take today to protect your prostate and bladder for tomorrow. Take care.